Here's a narrative describing the process a patient typically follows during a visit to a clinic. When a patient arrives at the clinic, the first point of contact is usually the receptionist. The receptionist greets the patient, verifies their appointment, collects identification and insurance information, and ensures all necessary paperwork is completed. If the patient is a walk-in, the receptionist may check for availability and add them to the schedule. After checking in, the patient is called into the examination area by a medical assistant. The medical assistant takes vital signs such as blood pressure, temperature, pulse, and weight. They may also review the patient's medical history, update their records, and ask questions about the reason for the visit. This ensures the provider has up-to-date information before seeing the patient. If lab work is required, the patient is directed to a lab technician. The lab technician collects blood, urine, or other samples for testing and processes them as needed. Depending on the clinic, these tests may be completed on-site or sent to an external lab for analysis. Once these preparatory steps are complete, the patient meets with the physician, nurse practitioner, or physician assistant. This healthcare provider conducts the primary consultation, discussing symptoms, diagnosing conditions, and formulating a treatment plan. They may order additional tests, explain results, and answer the patient's questions. If the situation requires specialized care, the provider might issue a referral to a specialist. If medications are prescribed, the patient receives instructions on how to obtain them, either through an on-site pharmacy or an external one. The provider may also give advice on follow-up care or lifestyle changes to support recovery. Finally, the patient stops at the checkout desk, where they can schedule follow-up appointments and settle any copays or billing matters. The receptionist ensures that the patient understands their next steps before leaving the clinic. This narrative provides a clear overview of each step and the roles of the staff involved.